randomized controlled trial just came out. The first studies where we're really using Ozempic GLP-1 glucagon-like peptide for substance use. So this is exciting in that it's pushing our knowledge further in this area and starting to study it. It took 50 people and it followed them over about 8 weeks. These were people who weren't necessarily looking for alcohol treatment, who weren't motivated to stop drinking, who were decreasing their alcohol use. So it's an early sign that there may be something more here, that there may be some promise. At this stage, I think that there's excitement. There's a lot more efficacy that we really have to see play out in bigger, larger, and longer trials. I would expect at least a few more years before we have more clear guidance on where these medications are going to fit in the addiction world. Last part of this, I want to talk about the risks. We want to put the medication into perspective of how much we know about it and how much we don't know about it. Especially with a new medication, a lot of the risks, especially longer term, are still unknown. We want to look at some of the things that we know we're seeing with Ozempic, some associations regarding worsening nourishment. Someone with a substance use problem, they also have risk of nourishment problems. These are deficiencies in vitamins. Someone with alcohol use disorder is at higher risk of developing an insufficiency of thiamine, which can cause significant problems for their brain and their memory. If we look at combining something that may have them eat less, in addition to the alcohol, which may be preventing them from getting all the nourishment they need, we could have more risks regarding the nourishment. We need to really wait and see how some of these studies bring in people with psychiatric problems, bring in people with substance use problems, and see how they do on these medications before people jump to use them. I think a lot of caution still at this point with some optimism and making sure that someone's always speaking to a doctor about what kind of medications they're adding or changing on the regimen.